4 communication skills, number 4. Write down 4. 4 history taking, 4 management, 4 marks. So how many marks for management? 4. How many marks for history? How many marks for communication? So each station, each OSCE, how many marks? 12. Divided equally 3 domains. But listen to this trick. Listen to this trick. In an OSCE, listen to this because many people come to UK to pass step 2 and they struggle a lot because of little things here. In an OSCE, you will never find a candidate who scores 1 out of 4 in communication. 1 out of, and passes the station. Meaning, every station has a mark at the end, a passing score, okay? Say the passing score is 7. The passing score is 7 out of 12. So say the passing score is 7 out of, you need to understand this point. 7 out of 12 passing score. Okay, listen carefully. The examiner, if the examiner gives you 1 out of 4 in communication, 1 out of 4 in, you will never pass the station. You will never find yourself getting 4, 4, 1. 4 management out of 4. 4 history out of 4, 1 in communication. Never. If I am not happy with you in communication, I will make sure you fail the station. Dr. Mo, what if I take perfect history and I do perfect management lesson, but I don't have communication skills? I don't know how to communicate. I don't have good communication. But perfect history, perfect management. Will I pass? No, the examiner will make sure he fails you because you cannot pass with bad communication. The other way around. What if I have good communication skills, but I was okay in history and okay in management? I said okay, not bad, because if you are not safe doctor, if you are not good doctor, as medical knowledge, you're not going to pass. But okay, if I'm happy with you in communication and I give you 3 out of 4, for example, I can let you pass the station as long as you are safe, not really horrible in terms of knowledge. Does that make sense? Meaning, an examiner is instructed. If you don't have good communication skills, even if your medical knowledge is perfect, you will not pass the test, or you will not pass the station. Guys, did you get this point? So the point of communication skills, some people think that I will go to the exam, I will read plenty of books, I will be very knowledgeable, and then when they go to the exam, they don't have communication. No please, no thank you. When they talk to the patient about management, they will say, we will do this, we will give you this medication, we will give you these antibiotics. That is wrong. Always when you manage the patient, what should you do when you manage the patient? What should you do when you manage the patient? When you are telling the patient some instructions, what should you do? Okay, read the cause. Okay, I'm talking about the communication part. How do you communicate during the management? Sorry? Perfect. Ask for consent before you manage. Always, when you're managing a patient, don't say to him, I highly advise you to take such medication, and no. There is such and such. What do you think? Can you do this? Is that something you can do? Is that something doable? You understand me, guys? Always when you are talking to the patient about management, take his opinion. Take his, what does that mean, take his opinion? What is the meaning of take the patient to opinion, guys? Guys, please. What do I mean by take the patient to opinion when you are managing? Guys, if you are talking to the patient about diet or smoking, how do you talk to him? Doctor, tell me, if you are talking to me about smoking, if you are advising me about smoking, how would you advise me?